There is a problem with medical or billing records for many out-of-network providers. Why is it important? What can you do about it? Welcome. I am the Medical Bill Whisperer, a previous billing manager turned patient advocate. I am committed to bringing answers, insights, and solutions to patients like you. Let's start. Why is it important? Through a referral from your PCP or another specialist, or because there is no other choice in the in-network list, you have gone to an out-of-network provider for services, which you likely had to pay upfront and cash, but you received an invoice to get reimbursed. However, due to a medical records issue, either proof of service has not been established, need for authorization has not been followed, or medical necessity has not been established and your claim has been denied. Or billing records, a super bill, a claim form, an invoice is missing information, shows incorrect coding, or is illegible. Here is another denial. You see the problem? You cannot get paid without good medical records and correct billing records. But out-of-network providers too often don't keep good enough records. Why not, you ask? Well, they get paid directly by you and in full. There is no financial incentive for them to produce any better records. They don't deal with insurance. Oftentimes, their practice is small, even individual. They do not have the staff or the knowledge of how insurance plans work, how benefits and coverage rules are necessary to get a claim paid. Smaller practices may not have an electronic medical record system, still may keep hand notes on paper charts, leading to poor record keeping. In some cases, invoices are even produced in a Word document or through general invoicing like QuickBooks. These are not the proper format for insurance companies. And services often outside the norm lead to limited time, resources of willingness to document services rendered out of network, and certainly the inability to properly code those services. But poor, lacking, or inadequate medical or billing records will all lead to a rejection. The Medicare rule used widely across the healthcare industry is, if it's not written, it does not exist. If it's not in the records, it did not happen. As for claim forms, super bills, or invoices, if they are incorrect, invalid, incomplete, or illegible, meaning the system cannot read them, it cannot be processed and therefore cannot be paid. So what can you do? The first is obvious, but maybe not that evident. It is to try and locate an in-network provider. And trust me, I know it's not always easy. Or you can try and get in-network coverage for out-of-network services through continuation of care. If your current out-of-network provider was once in-network but terminated their contract, or if your provider was in-network with your previous plan but not with your current one, and if treatment is not over or transfer of care could be harmful to your health, you can request continuation of care, meaning your current out-of-network provider would get paid at the in-network rate, saving you money. Asking for a single case agreement is an option, but it means that the provider has agreed upfront to discuss a potential contract for you and your services only with your insurance plan. If they are not willing to even listen to such an agreement, a single case agreement has no chance of success. But you can potentially get in-for-out coverage through an authorization of that name. Although you would still be responsible for full payment of the out-of-network services, you would get reimbursed at the higher in-network rate, and the provider would not have to sign a one-time contract or agreement. You should always insist on proper paperwork. Every invoice, superbill, or claim form must show your complete and current demographics, including address, date of birth, but also the provider's complete information, including the tax ID number, contact address, full credentials, signature, and the NPI, National Provider Identifier. That can be different from the billing entity's NPI, tax ID number, address, or contact info. The services must be detailed by date of service, place of service. Was it teledoc, in-office, in or outpatient, in a hospital? How much was the price per service, per line, per unit, and overall? And other codes describing the exact diagnosis, the detailed services, and any special circumstances up to date? If they are, great. That just raised your chances of getting reimbursed fast and well. As for medical records, they must reflect a whole bunch of stuff. The reason why the service was rendered, the level of complexity of the decision by the provider, how much time they spent with you, whether face-to-face or looking at external reports or test results. What supplies were used, if any? Were referrals to other providers or specialists issued? Prescriptions prescribed? Tests or labs ordered? Was a treatment plan discussed with you? And more. Although a patient or family history may not be needed every single time, the reason for the consultation or service, vital signs, any action taken or ordered must be included in that session, visit, or procedure's medical record. Whether handwritten or through an electronic medical record system, keeping accurate medical records is definitely part of a clinician's licensing requirement. You should ask or demand assistance whenever needed. Don't ask, "Can you help me?" but rather, "How or how soon can you do this?" Respond to an insurance request for a copy of medical records. Address a claim denial, maybe for an incorrect code. Need for authorization by obtaining a retro authorization instead. Correct an invoice with a missing tax ID number, for example. No is not an answer, as are, "We don't handle insurance. It's your insurance, you deal with it. We don't share records. We don't have to answer to an insurance request. We are not contracted," and so on. Providing adequate invoices, claim forms, or super bills for you to get reimbursed by your insurance is also a requirement under every clinical or medical license. Last but not least, always keep track and follow up. Your online portal should keep a record of what you uploaded and when. Give it a few days, 30 usually at the most, for your invoice or claim to show up either as pending, denied, or in process under your explanation of benefit list. You may receive a letter through the online message center or via snail mail. An EOB, explanation of benefit, could also have been issued showing how a claim was denied, rejected, pended, or paid. If you don't see anything after 30 days, it is time for a call to your insurance. If there is a problem and the provider's medical records or billing records are the reason, asking that office for specific action or specific document has the best chances of getting you help and getting you reimbursed by your insurance plan. And don't listen to advice to resubmit. The odds are a duplicate explanation of benefit would be issued, and the original reason why the claim was not processed or paid still would remain a mystery. So try and find out exactly what is lacking, missing, incorrect, inadequate, and so on. And ask the provider, the staff, the billing department, or billing manager for specific action. What must be in the medical records? What must show on an invoice? Helping the provider help you will help the insurance help you get paid. Thank you for watching and for your likes, comments, and subscribe.